Washington Journal continues.
Congressman Pete Sessions of Texas is with us, and long-term member of the House Rules Committee. And as those of you in the C-SPAN audience know, Rules is the first stop before legislation actually gets to the floor. He's going to tell us about what the options and possible strategy are for Republicans as health care legislation makes its way to the floor. Thanks for being with us.
Glad to be with you.
Well, let me start with that broad question. What are your options and what is your strategy for the health care legislation?
Well, the most important thing, I believe, Susan, is that we make sure that whatever comes to the Rules Committee, after it is all compilated and put together by the Rules Committee and the Speaker's staff, that the American people and every member know and understand what's in the bill. That's the most important thing.
And how can that get done?
It's really, the process has started now. We have formally asked not only the Speaker, but in legislation, we've said we need 72 hours to make sure that everybody reads the bill. It will be important for the Rules Committee, I think, to have cameras that are on the inside to where questions are asked. President Obama was open about saying we need to make sure there's nothing done behind closed doors. The American people need to be in the room at the same time. This bill, which I have before me, is the compilation, and there's one more of these also, of H.R. 3200. If you read any one page, you see that you've got to study it for a minute.
Let me stack them up so people can see.
Yeah, there they are.
Over 1,500 pages combined?
It is, and it's a big bill. And I think it's important that we get this right and that the American people understand what we're voting on, but more particular, the members need to know what they're doing. So I think process will be one of the most important and key elements. Obviously, the Rules Committee will have to make a determination. Is there going to be any part of this rule that will be open to amendment? Will, for instance, some what we call blue dogs, will they be allowed to have an amendment? Will Republicans be allowed to have an amendment or an alternative? And these are certainly good questions. The Rules Committee for the past, well, ever since Nancy Pelosi has taken over, has not lived up to the reputation of even having the bills that are available. You'll recall several times we've gotten a 1,000-page bill at 3 o'clock in the morning only to vote on it hours later. The Democrats need to make sure, and the leadership need to make sure that this bill is open to the process, not just members, but the American people.
And what reaction are you getting to these requests from leadership?
The answer, by and large, is we'll see when we get there. And this is an interesting point, and it's not unusual at all. I don't think that they know exactly what the bill's going to look like today either. And since they don't know, and since we don't know, it's a good reason that we should begin putting into place right now our requests that are straight up about since you don't know and since we don't know, let's move forward on the process together. And I think that Mrs. Pelosi would make a mistake if she is not open to this process.
Well, moving beyond the process, which all of our viewers will understand is important to the policy itself, so far we have heard repeatedly that no members of the Republican caucus or conference are prepared to support this legislation. Is that still the case?
The way we understand the bill, that would be correct. And there are lots of reasons why. There are even reasons why lots of Democrats don't want to support the bill. The biggest reason is that in the scheme of things, this will take away a patient's right and opportunity to control their own destiny with their own doctor. Second of all, it will lose 4.7 to 5 million American jobs because it's a massive tax on small business. And those are great reasons to say we should start over. Republicans have, for a number of months, going back to August, said and heard from the American people, there are a number of things which we think should be included in this plan. And if you would like for us to work with you, start including these ideas. We've not heard back any of those.
So Republican strategy will be to focus on joining forces with moderate Democrats in order to defeat the current legislation?
I believe that Republicans are going to be entirely on the side of process. I don't know that we have a lot in common with trying to negotiate with Democrats. That's what the Democrats are having to do. They're negotiating over language of abortion services. They're negotiating over illegal immigrants They're the ones that are in that negotiation, not us. We're on the side of trying to propose good ideas that would help us to vote for the bill, make the bill better, and process.
Let's get to calls, beginning with Barnegat, New Jersey. This is Pat on the Republican line.
Yes, good morning.
Good morning.
Good morning, Pat.
If after the next election there are many more Republicans, would it be possible to revisit this bill and tweak it at all,
Pat,
even if it gets passed?
Pat, Pat, thank you for your question. I think it's important for us to know that Republicans right now are at the table and asking in, we believe, a forthright manner, let's open up the process, let's take all the ideas that are on the table and let's include them. Republicans are not no for making health care better. We are in the process of KNOW that this bill is a bad bill. We know this is a bad bill. We want to make it better. Now to your question. Republicans, I believe, will find themselves in the American people where next year we will go and run a campaign on this massive government spending, this big health care bill, and the Democrats will be held accountable for it. Republicans, as always, would and do see the world differently. We want a health care system that works for everybody.
For Congressman Pete Sessions next, Hamilton, New Jersey. Our caller is Mike on our Democrats line.
Yes, Congressman, I'd like you to answer this question just from the perspective as a Christian. I assume you're a Christian, since all politicians these days proclaim their Christianity when they're running for office and include that as part of their philosophy, I suppose. But ignoring economic considerations, the disruption to the economy, ignoring procedural, legislative procedure, political philosophy, and other questions, just if you could answer this question for me. What is the moral justification for placing a business whose reason for existence is to make a profit? Doesn't make them evil. That's the reason for existence of a business. What is the moral justification for placing a business between a patient and medical treatment, as we do? Now, we answered that question some 45 years ago regarding a certain segment of our population, seniors and the destitute. You have to be destitute to get Medicaid. But can you answer that question for me as a Christian?
All right, sir, we get it.
Let me see if we can answer the question. Morality does have a lot to do with public policy. And doing things for a larger group of people, because we as members of Congress believe it's the right thing to do, is a proper justification. I would say to you that there is in this country a process and a procedure. And we have for years built a free enterprise system that has done a very good job to make sure that not only is the free enterprise system responsible to its employees, but provides the benefits of making sure that we pay the taxes that are necessary to run this United States government, and then the government uses its policy to help people. I'm very concerned, and I believe all Republicans are, that we find a bill that will work, that the American people can support. And supporting the bill and making it work is very important. This bill is not sustainable from a financial aspect. It is not sustainable, and in testimony that I've had back in Dallas, Texas, in Fort Worth, Texas, which is our neighbors just to the west, the largest public hospital there has indicated publicly that if this bill passes, they quite likely will close their doors because the government is only able to reimburse in this bill at 30% of marketplace. So I would say back to you, there's a moral dilemma there too. If you extend the auspices of government and tell people that government will be there and then cannot financially pay for that, or place a responsibility on someone else because the government, the federal government, doesn't want to do it, it is a theory that was great in Washington but didn't work back home. We need to make sure we sustain this bill. This bill is not something that can pass that test for the light of day. And if we're going to do something for American people, we have an obligation to be thoughtful and truthful about what we're going to pass.
I think this is related. This is a viewer, Timothy Sutton, who writes, Congressman, shouldn't we implement a plan that requires